the RTOG 0712 was designed to compare two concurrent chemoradiation regimens, which were popular and effective regimens back in 2007. One was the RTOG standard at the time, which was fluorouracil, cisplatin plus twice daily radiation. And the other was gemcitabine plus daily radiation. This was designed as a selective bladder preservation trial, which differs slightly from current trials in that there was a mid-treatment break and an assessment at that time for response to treatment. Patients with a complete response to treatment went on and completed their course of concurrent chemoradiation. Those with a lesser response were referred for immediate cystectomy. So that was the trial design was to compare those two regimens. And the trial design was designed to see if either of the two regimens reached a benchmark, which was freedom from distant metastases at 3 years and greater than 75% free of distant metastases was the benchmark set at that time. Both arms met that. So both were found to be efficacious in terms of bladder sparing and also averting the development of distant metastases at 3 years. This more current study is an update of that trial, and it shows that these results were durable at 5 and 7 years. Given the data that we presented, we weren't able to identify subgroups where there were better outcomes. That being said, there are some preferences that can be derived from analyzing this trial. One, the daily radiation regimen is far more convenient for patients and clinicians. So the fact that that was an equivalent to the twice daily regimen was a nice finding. And most current bladder sparing regimens are once a day radiation regimens. So that did favor the gemcitabine arm to some extent. But that wasn't necessarily based on the data in the study that found a more favorable outcome in that group. It was just that all things being equal, that was a more convenient regimen for patients and also for practices. The way I would regard this study is sort of as a backbone to where care is can go going forward. And I think that this, in the context of other RTOG multi-institutional trials, as well as there's large British randomized series as well, I think there is sufficient evidence at this point that a bladder-sparing chemoradiation is a safe alternative to cystectomy for many patients with muscle-invasive bladder cancers. Quality of life outcomes are likely better, although no head-to-head comparisons have been made. Bladder function is excellent in patients participating in these studies. Generally speaking, you could expect a bladder preservation rate of 80% or greater, up to 90% in some selected series for patients who undergo bladder preservation for muscle-invasive bladder cancer. So I believe that this demonstrates that this is an effective treatment going forward. In terms of systemic therapy, small molecule therapy and immunotherapy has proven to be quite effective in bladder cancer, and those regimens are being folded into bladder sparing regimens.